In the studios this morning, Kristen Lundgren with United Way and Claire Oakley of Riverstone Health. Good morning. We're here to talk this morning about a great project. It's called Montana 211 or 211 Montana, whatever way you kind of want to do it there. And we're going to be talking about two different aspects of this. Of course, it's basically a help site. People can phone in if they're maybe having problems, paying for the rent or food or whatever. And this is for veterans and basically everyone that is going through a crisis in their life.
Yeah, absolutely. It's 211 is for everyone. The idea is that it should be as easy to find non-emergency help as it is emergency help. So we all know to dial 911 in an emergency. We would like for everyone to know to dial 211. Like you said, if they're looking for help, anybody looking for rent assistance, looking for housing, employment, childcare. And we are especially wanting to get the message out to service members, veterans, and their families today, approaching Memorial Day weekend. And they're just such a special segment of our society. And we want to be sure that they know about 211. And there is actually a special service member and veteran hot button on the website. So it's easy to just click right in there and see what's available for you. If you call the phone number and identify yourself as a service member, a veteran, or a family member of a veteran, they'll also be able to give you that kind of specific help.
Now, the 211 got a great grant money from the VA, so they're really behind this. Claire, you were part of the Mayor's Challenge that was last year. Let's talk a little bit about that and how this is kind of all coming together with that Mayor's Challenge.
The Mayor's Challenge is still ongoing, and our vision is for Billings to be a community of support for service members, veterans, and their families to live, work, and play. And our mission is building community connections through collaboration, suicide prevention, resources, and training. And so a very key part of our action plan is to bolster and enhance Montana 211 as the go-to resource for anybody who is seeking information, any kind of resource, so that we can so that people don't reach a crisis situation.
I always say, Montana 211 is there to alleviate any stressors before, the ultimate suicide comes about. So this is a great deal. So the Mayor's Challenge is now kind of dwarfing into the Governor's Challenge, so to speak. Kind of. I know there's a little misconception out there. So correct me. You can say, Scott, you're stupid on this. This is what it's all about.
It is kind of complicated, and we were a little confused at first. But really what it is we've got two local Mayor's Challenge teams, one in Billings, one in Helena, and then there's this overarching Governor's Challenge to work on policy and big topics that can be accomplished across the state. So we have the local piece, then we have the state piece. And Montana 211 is an important part of that Governor's Challenge piece also. Again, as a key resource for everybody in the state.
Kristen, when people go up to montana211.org, and this is nationwide, I think there's a couple states that aren't involved with it, but this is a nationwide deal. So have you kind of molded this after, like, maybe a certain state where you went up on their website and says, I love North Dakota's website, or I love Nevada's website. Is there kind of a model out there that you kind of homed into?
Well, that is the advantage of coming in late.
Yeah, that is a big event.
We have been able to scour, the universe of 211 to find great examples. And in fact, we're very proud of our website. When you go to our website, we think it's one of the best in the country to make it easy for people to find help. So we've put a lot of energy, and again, with the help from from Healthy by Design, Riverstone, St. V's, and Billings Clinic have really helped us initially with an initial grant to get that website highly functional. So I need to give credit to them. Thank you for that.
Yeah.
That's a gift to all of Montana, honestly. So yes, we have been able to look nationwide and certainly are continuing to consult with national experts on 211 about how to make this the best it can be.
You know, when we talk, go ahead, Clint.
I was just going to add, and recently you were able to take the whole Montana 211 team to D.C. to work with national experts. Do you want to speak about that?
Yeah, talk about that. That would be really interesting.
Absolutely, and that was part of what we were able to do with the help of this Governor's Challenge to prevent veteran suicide. Yeah, we took a team of 211 folks from Montana to D.C., met with national experts to talk about, how do we improve the system, what's on the horizon for 211 nationally. There are some really exciting things on the horizon nationally, and so we're able to benefit from that kind of TA, again, thanks to the Mayor's Challenge to prevent veteran suicide, and the VA really getting behind us right now.
Because it's been rolling out, and next week VA Montana is going to have 3 listening sessions, whatever you want to call it, on the Mission Act. One's going to be here on Billings. I think it's on the 30th or 31st. It's on the 30th. And this is, whenever a new program is rolled out, it gets kind of daunting and everything like that. Will there be information on that website about the Mission Act?
That's a good question. I don't know, and I will look into that.
Yeah.
It is a resource referral, so if there's any resources that people need to know about, need to be easily able to access, because of the Mission Act, then that will, for sure, end up on the website.
If you were to go to that website as a person that helped create it, such as yourself, what would you say? Gosh dang it, I'm proud about this one. Just, and you can only home it down to one thing. I know it's just like, at Christmas time asking what kind of present you want and everything, it's kind of difficult.
If you want my Christmas list, I'll give it to you.
Okay, there you go. But if there's one thing you go on there and says, I'm proud of that.
It is so easy. You go on there and we call them the hot buttons, but you're looking for food, you're looking for housing, you're a veteran, you're looking for, childcare, family. It's so easy to navigate.
And that's a whole bit there, because some people go up to a website and they're so hard to navigate that you just kind of throw your hands up in the air. And when a veteran or somebody else who's going through a rough time, they're going, okay, I need help with this, and you're looking at a website, you go, I don't really understand, and then you just kind of say, fooey on it, and everything like that. So the easier, the better.
Yeah. I think I'm most proud of that.
Yeah.
Well, I'm really pleased with respect to the change at the website for service members, veterans, and their families. We made a very simple change last July on the changing the veteran button to service members and veteran buttons, and we saw a very fast jump in people accessing that, and then with the analytics associated with it, we can go in and see exactly what they're looking for, and that's pretty exciting.
Yeah, and so when somebody's going up there and maybe they're not finding what they want, is there a thing that they can put, like a suggestion, like furniture or whatever it might be?
Yes, absolutely. We've put the hot buttons first because we think that makes it easiest. But if you're not finding what you need there, you can scroll past the hot buttons, and there's actually a sign that says "Didn't find what you're looking for." You can enter a keyword and search.
Yeah, and the easier the better, because sometimes a veteran, like the Vietnam veterans, any veterans, they're going through a lot of stuff in their life, and they just don't want the hassle. So the easier you can make it for a person, the better. Claire,
let me just say too about the ease factor. If the website is daunting, if you're having trouble with your phone, you can call 211.
Yeah,
and you get a great person on the other end of the line.
I'll give you Kristen's phone number here too. No, I won't do that. Claire, let's talk about your passion for the veterans out there, because you could be doing a lot of different stuff, but you're really involved with these veterans. Let's talk about your passion for that.
Well, I was appointed by SAMHSA VA as the local lead for the Mayor's Challenge, and I think it grew out of our work in general for suicide prevention with with the local Suicide Prevention Coalition of Yellowstone Valley, and obviously service members and veterans are absolutely key portion of any community. Montana is number 2 in the country as having the highest level of veterans per capita, and so we need to make our community healthy for everybody. And if we specifically look towards making it healthier for veterans and service members, everybody is going to benefit from that. And so with this emphasis by SAMHSA and the VA, we have this absolutely wonderful opportunity to make an impact.
Now, if you want more information on Montana 211, of course, you can go to the website. You guys are going to be at the Food Truck Battle coming up here on Saturday, June the 15th at Metro Park. And, of course, they can call. Can they just call United Way, too?
They can. They can just call United Way. The best number to call would be 272-8505.
Okay. Is there a specific person they should talk to, or?
Well, they can talk to me. That's Chris. That's my number I just gave out.
Okay.
Kristen. They can also talk to Brenda. Brenda's our 211 manager, and she has the best information. And then I'm not giving her phone number right now because I'm not positive I have the last digit right.
Okay. And you started your radio campaign on the 13th. Next week you start your social media. What are people going to see when they go up on different sites and everything with the social media part?
They'll just be seeing some short little videos that demonstrate what 211 can do, some pictures of the hot buttons, and of course how you can access it. A direct link, if you might see it pop up in a Facebook feed, that kind of thing. There'll be a direct link you can click on to the website, or again dialing the number 211.